Hey guys, you are welcome to my YouTube channel. My name is Dr. Ipeleng and I speak about everything women's health. If you're interested in that kind of information, go ahead and click on the subscribe button. On today's video, I am going to be talking about menopause. Everybody goes through menopause, or rather every woman at one point in their life is going to go through menopause. This is not something that you can prevent. Even then, I think it helps to get some information and know what is happening with your body in this time, and also learn the things that you can do, and some of the treatments that you can take to alleviate the symptoms of menopause, and even to prevent some of the complications associated with menopause. So, what is menopause? Menopause is the time in a woman's life that marks the end of the menstrual cycles, and it is diagnosed 12 months after your very last period. Although this is a biological process, the physical symptoms such as night sweats and some of the emotional symptoms such as mood changes or mood swings can lead to lack of sleep and even affect your emotional well-being. Some of the symptoms that are associated with perimenopause, and perimenopause is a few months or even a few years leading up to menopause. Some of the symptoms associated with that period are irregular periods. This means you will skip some of your periods when you are close to menopause, and this is very normal. But even then, be very careful because you can get pregnant during perimenopause. So you still need to continue on taking prevention to prevent, or rather yourself from getting pregnant if you don't want to get pregnant in that period. So skipping periods, you can even have heavy periods than normal. Some of the periods can be heavy or they can be shorter. That means like the cycles will be shorter. If you're having 28 days, they can go down to maybe 20 days. That means you have like uh, your periods one period after another. So that is one symptom, irregular periods. And then you can have hot flashes, chills, night sweats, and then emotional symptoms such as mood swings. And then you can also have weight gain. As the levels of estrogen goes down, you will have weight gain. So in this time of your life, you need to exercise more and eat less. So I forgot to mention thinning hair, dry skin, and even vaginal dryness, which happens during perimenopause, continuing even after menopause. So you actually may be surprised to learn that there are a few causes of menopause. The first one being the one that we know, the natural one. As you reach your late 30s, the ovaries start to produce less and less progesterone and estrogen, and your fertility declines. When you get to your 40s, the periods may become irregular. This means more or less frequent. They may become lighter or heavier. They may become longer or shorter. And then in your late 40s and early 50s, the ovaries will stop producing the egg, stop producing the hormones that I just mentioned, and you will reach menopause. The second cause of menopause is oophorectomy. Oophorectomy is the operation where your ovaries are removed and you will reach menopause abruptly. And because you reach menopause very suddenly, what is going to happen is the symptoms might be much more severe than when you reach menopause gradually, and the level of the hormones go down gradually. So the symptoms will be much more severe. The third cause of menopause can be chemotherapy and radiation. For people that have cancer and are undergoing those kinds of treatment, it can lead to menopause. The fourth cause of menopause is what we call premature ovarian failure. This is when you reach menopause in your 30s instead of your 40s or your 50s. The cause of this most of the time is not known, but it can be genetic causes. Some of the causes can be genetic and autoimmune. Some autoimmune diseases can lead to premature ovarian failure. and about 1% of women reach menopause in their 30s. So this is actually a lot of women if you look at it, 1%. In this women, it is encouraged to give hormone therapy up until the age where they were supposed to reach menopause normally. Up until late 40s or early 50s, they will get hormone replacement therapy. Let's talk about complications of menopause. After menopause, your risk of getting certain medical conditions increases. The first one being cardiovascular diseases. This means the blood vessels and the heart. When the estrogen levels decline, the risk of getting cardiovascular diseases increases. This is very important because at this point in your life, you have to learn that you are going to need to start exercising and eating healthy and even eating less to avoid getting obesity, because there is weight gain that is associated as well with postmenopause. So you need to start taking care of yourself, because heart disease is one of the leading causes of death in both men and women. If you're already having hypertension and you already have like high cholesterol, you need to speak to your doctor to get this medical conditions under control to lower your risk of getting heart diseases. The second complication is osteoporosis. This is a condition that leads the bones to be brittle and weak. This is why in women who have reached menopause or after menopause, there's a high risk of hip fracture, wrist fracture, or even back fracture in those women, because the bones become very brittle and weak. The third complication is urinary incontinence. As you reach menopause or after menopause, there is loss of elasticity in the tissues of your vagina and urethra, and this can lead to urinary incontinence. This can be triggered from anything as lifting heavy objects, laughing, or even coughing. We call this stress incontinence, or urge incontinence, which can be frequent and even urge to urinate, leading to involuntary urination. This is where the Kegel exercises come in. The Kegel exercises help to strengthen the pelvic floor muscles. Another option is the use of topical estrogen in your vagina, or even the use of hormone therapy. So, hormone replacement therapy, because it helps with the changes that take place in the urinary tract and the reproductive tract of a woman after menopause. Third complication is the sexual function. After menopause, or when you're approaching menopause, there is vaginal dryness, which is caused by obviously the lowering of estrogen. The vaginal dryness can lead to painful intercourse and even bleeding during intercourse, which can lead to women losing interest in sexual intercourse, and also the loss of sensitivity can lead to loss of libido or loss of interest in having sex, because now there's loss of sensitivity. The other complication is weight gain. By the way, you can also use topical estrogen in your vagina, or even use some lubricants when it comes to helping with the sexual function. So those kind of stuff are readily available in the pharmacies, I think, or you can ask your gynecologist. The last complication is the weight gain. The slowing of metabolism after menopause leads to weight gain. So, like I think I have already mentioned, this is when you need to maybe eat less, start exercising more, and eating healthy to avoid overweight and obesity. That is all for today.